And we are back. Joining us via Zoom all the way from Kingston, Jamaica, we have with us the Executive Director for the Caribbean Vulnerable Communities, Mr. Ivan Cruickshank. Good morning, Mr. Ivan.
Good morning, good morning. I'm happy to join you this morning.
We're talking about World AIDS Day, and the theme is Let Communities Lead. What was the initial thought process surrounding that theme? What is it about vulnerable communities that their voices need to be heard more around the table?
All right, so thank you very much for that question, and I should say good morning to your listeners. So the theme, Let Communities Lead, is really a recognition of the importance of the voices of the people who we're providing services to in the conversation about what those services should look like, how they should be designed, and how they should be delivered. We know from our own work and our experience that if you don't engage the people who are trying to solve their problem, to get a better understanding of what are the causes of the problem, what are some possible solutions, then we tend to be just providing services in abstract. And I think the intention here is pretty much saying to us, please ensure that you're having the people who, where we see the evidence is showing that the epidemic is in those communities, have them at the table. Talk to them about what are the issues that matter to them. Talk to them about how together we can solve their problems. And not just what we have seen historically where somebody decides that this is your problem, this is your solutions, let me give it to you. Yeah. So I think that the theme is responding to that particular imperative.
We had this discussion last week locally here in Belize with the AIDS Commission, and it seems that there's a lot going on, particularly here in Belize. I can't speak for other Caribbean communities, in terms of facilitating education. There are clinics for checkups. The public health has their particular events and so forth to get testing going. And so here at home, it seems that we are educating the community as best as we can. What is lacking in certain areas or other communities you would think that we would need to get ahead of?
I think the biggest barrier we face in the HIV response across the region is the issue around addressing stigma and discrimination.
Yeah.
So what we have found is that the public health system is scaling up the services that they're delivering to people. We're offering new innovations such as HIV self-testing and pre-exposure prophylaxis. We are scaling up access to treatment and related services. But what we're not seeing people coming and taking up the services with the same intensity that we desire. That is because there still remains a significant challenge with HIV stigma in our health facilities, in our communities. So nobody wants to get tested to find out they're positive, to then have to deal with the stigma of being an HIV positive person. Despite the much work that we have done so far, we still have communities where people are ostracized because they are HIV positive. You still have people losing their jobs in certain instances because of their HIV status. You still have people, in fact, women who are HIV positive, who are being told you cannot have children, even though the evidence is showing that you can still be a mother as long as you're on your treatment and you are taking your medication consistently, you have gotten to viral suppression, and there are systems around you to ensure that you do not transmit the virus to your child. So all of those stigmas do in fact affect people's ability and willingness to come forward to get tested and to go into care and remain in care once they are diagnosed as being positive.
So Ivan,
the other issue,
sorry, yeah. Go ahead, Ivan.
The other issue is that we have also seen that HIV is much more prominent in certain key and vulnerable population groups. Those populations are also facing another layer of stigma. Stigma around whether it is your job as a sex worker, stigma around you being a transgender person, your stigma around you being a man who has sex with another man, a stigma around people with disability, stigma around young people, that young people should not be engaging in sex, and therefore you're stigmatized if you're a young person who is involved in sex and you're not given the type of service that is required. So those layers of stigma are really the issues that are driving the response and affecting our ability to get to epidemic control across a number of the countries in the Caribbean.
So let's talk advocacy, because you have identified various levels of stigma and various aspects of it. What is being done from a regional perspective to advocate for, a move away from discrimination, a move away from stigma, a move for persons to be more aware and enlightened of what the actual situation regarding HIV is and the response?
Right. So, excellent question. So, we have taken a two-pronged approach, in fact, three-pronged approach to addressing the issue of stigma and discrimination. The first is a recognition that the people who deliver services need to be sensitized, because you do have stigma among those who are providing the services. So we have looked at sensitization sessions with healthcare workers, and we have done some of that in Belize, with police who actually have to interact with people on a day-to-day basis, with people within the judicial system, because a critical piece of this work is to ensure that everybody gets justice. So if somebody is discriminated against, if they're violated, then they need to be able to access the justice system. We haven't done any work in the education system, certainly from CBC's end, but we know that there are other organizations that are actually working within the education system to sensitize those persons within the system to ensure that if a child comes into the system and the child is HIV positive, that there is a response mechanism within the system to protect that child. And indeed, if a teacher in the system is HIV positive, that the system can work to protect that teacher. So that's the first prong that we work on. The second one we work on is building understanding among the communities themselves, because we recognize that people need to understand what stigma is so they can recognize it and they can challenge it. So part of our work is to ensure that the communities that we're working with fully understand their rights, when those rights are violated, when stigma is being perpetrated, and where discrimination occurs, they understand how to report that discrimination, how they can actually seek redress for those acts of discrimination. The third prong is that we're working on at the regional level is that we're working at both national and regional level through our advocacy actions that we do in collaboration with local organizations or with regional organizations like the Pan-Caribbean Partnership on HIV/AIDS. We have developed collaboratively position papers on key issues around stigma and discrimination and access to service, access to justice. We have worked with PANCAP as well as other regional partners around working with faith-based leaders to do faith-based advocacy work. We have developed a comprehensive regional advocacy plan that we are implementing that includes campaigns to address stigma and discrimination both at the national level as well as at the regional level. So our work is geared towards several pieces of the work, or of the response. One is we are advocating for policy changes that would see countries putting in laws that protect people who are HIV infected or people who are affected by HIV/AIDS, which include our vulnerable groups. We're advocating for service delivery standards to be improved such that when somebody walks into a facility, they fully understand what to expect, and there are mechanisms in place to ensure that if those standards are not met, there are recourse actions that people can take and there are systems for redress within those spaces.
Yeah.
And we're looking at how do we advocate for coordinated national responses. So one of the things that we have been trying to advocate for is a regional anti-discrimination legislative framework where we have a draft anti-discrimination legislation that is done at the regional level, but which can be used at country level to make sure that we are addressing key components of the HIV response and addressing key issues around S&D that certainly affect many of the countries in the region. Mm-hmm. So, I mean, we're not just doing advocacy, we're doing advocacy, building up the capacity of communities to identify and respond to stigma, and we're doing sensitization work with key duty bearers to ensure that they are offering services that are free of stigma and discrimination.
You know, I hear you very much, Mr. Ivan, but you know, sometimes it's really hard to change the perceptions and the culture of a particular society, right? So I am all for policy change, I'm all for the advocacy and the education, but how do we ensure that there's genuine change? There is genuine consideration for persons that are living with this disease, because at the end of the day, it is just like every other disease that you have to take treatment for. So how do we begin that process of a behavioral change? I guess is the best way to call it. Yeah.
Right. So that's an excellent point that you raised, that change does not occur overnight, and we know that behavior change is one of the hardest things to accomplish. Mm-hmm. But we think that several things can be done. First, I think we need to increase the visibility of people living with HIV. Mm-hmm. We need to help the society to understand that people living with HIV are our brothers, our sisters, our nurses, our doctors, our teachers, the vendor that you buy supply from. These are all people who comprise this community of people called people living with HIV. So it is not some arbitrary stranger out there. And if people begin to understand that it is close to them, and indeed it affects them as a family, as a community, as a church, they begin to see things differently. So that's the first thing. Mm-hmm. The second thing that we have to do is that we have to identify champions from within our various spaces who can bring others on board based on their own influence and their own position. Mm-hmm. So you have people who are well positioned across the society who can help to make change. We use them in so many different areas of our social life, where we have these people who are people of influence, who are people of position, and we use them to change, whether it is around crime, mm-hmm. whether it is around attitudes to education, so many different things that we have asked them to support. And we believe that using champions in the same way around HIV is also a good strategy. Mm. Third thing that I think we need to do, we need to be able to go into communities and have community conversations, because one of the things that is driving the stigma is fear.
Yeah.
People fear what they don't understand. Mm-hmm. People fear what they don't know. How are we sitting in the communities over firesides, over these community, interventions that happen every day in communities? How do we ensure that HIV is a topic that is discussed in those spaces to help people begin to remove some of those fears that they have and that drive the stigma that we see? Finally, we need to normalize HIV within our public health space. Just like we have normalized cancer, just like we have normalized diabetes, we need to understand that HIV is just another long-term illness that people will have. It's not something that people are going to necessarily die from. It is not something that is contagious. We know how it is transmitted. We need to clarify transmission. Mm-hmm. If you do not have sex with somebody who is HIV positive, you will not get HIV. It's as simple as that. How do you do that? You make sure you take the necessary preventive mechanisms. We also know that somebody who's HIV positive, who is undetectable, is also untransmissible, which means that if you take your medication and you get to viral suppression, you are not going to transmit the virus. There's significant scientific evidence that shows that. These are the type of conversations we need to be having at the community level. So whether we go to a church and we have the discussion among church folks, whether we go to the community meeting, whether we go to the community center, whether we go to the school grounds, we need to have those conversations with people so that we can begin to remove some of those anxieties and fears that people have that drive stigma and discrimination. That is the level of work that we will need to do. It's not easy work, it's intense work, it requires dedication, it requires commitment, and here is where communities matter. This is where the communities can come in and can take leadership, whether it is a society, whether it is a church community, whether it is the PLHIV community. Communities can provide this leadership because they are trusted more than government, and they also have a much more intense ability to impact people's lives than a government actor might be able to do. So that would be my recommendation about how we address what seems to be this intractable issue around attitudinal change.
As we slowly wrap up our segment this morning, Mr. Cruickshank, how does your organization reach out to other members or other members of the Caribbean region? I understand right now you're in Jamaica. Do you have any networks in and around the Caribbean that you all work with and associate with to bring these kinds of advocacies to light?
Yes, we do. So CVC is actually a coalition, and our coalition consists of organizations and individuals from all of the countries in the region, both the Spanish, the English, and the Dutch. So I think we are well positioned as a network of actors to do this type of work. We also network with other regional organizations that also have membership across the different countries. We also, in our work, we work very closely with entities at country level, so whether it is a CSO at country level, and in the case of Belize, we work very closely with the National AIDS Commission to roll out a number of the interventions that we are rolling out, and in the designing of our advocacy work that we do. So our work, we don't as CVC work independently. We work with and through our national partners and our regional partners to ensure that the work has the type of impact that would get us to epidemic control in the various countries across the region, addressing both stigma and discrimination, scaling up prevention, and ensuring that people get on treatment and stay on treatment and get to viral suppression.
My final question for you, Ivan. What is the HIV/AIDS picture looking like from a regional perspective in terms of numbers and percentages if you compare it to other parts of the world?
All right. So at the macro level, the Caribbean is second to sub-Saharan Africa in terms of HIV prevalence, which means that for the number of people we have in the region, our HIV rate is quite high. The only country that is above us is the only region that is above us is sub-Saharan Africa. We in the Caribbean have estimated to have about 330,000 persons living with HIV across the region.
Yeah.
Across the region, we also know that daily we have about 44 persons who is infected with HIV on a daily basis. So we do have a problem. We also know that across the region, our key population groups have the highest prevalence of HIV. In fact, we have, for the men who have sex with men population, we have prevalence of as high as to about 32% of the estimated population with HIV in selected countries. For the sex workers, we have up to 9-10% in some of the countries, and for transgender populations, we do have up to about 51% in one or two of the countries. So we do have very high prevalence in key populations across the region. The region, though, as I say, our HIV prevalence is somewhere around 1.7, 1.8, which is relatively high compared to what it is in other regions, and definitely we are just behind sub-Saharan Africa in terms of what our prevalence looks like, which means that we have a lot of work to do. Yep. Mm-hmm. We also, in terms of our numbers, we are well behind the 95 target in many of the countries in the region. Mm-hmm. As a region, we are not there. Some countries are more advanced than others, but we really need to do some work to ensure that we get people diagnosed quickly, get them on treatment quickly, get them to viral suppression quickly, because that is the only way we will be able to control the epidemic, reduce new infections, and reduce deaths across the region.
Wow. Thank you so much, Mr. Ivan, for dropping by to share with us what your organization has pledged for the 2024 campaign against HIV/AIDS. We will keep tabs on what the Caribbean Vulnerable Communities Coalition is doing in the year to come. Thank you so much for being here.
Thank you for having me, and happy for this discussion to continue.
Thank you.